Hour, our regularly scheduled program. A number of people are scheduled to take part in the conference call this hour, including Education Commissioner Heather Mueller and State Epidemiologist and Health Department Medical Director Ruth Linfield. The main focus of the briefing is going to be the state's plan to inoculate young kids once the federal government signs off on the Pfizer vaccine, which will likely happen by next week. In a statement earlier today, Governor Walz said Minnesota has more than 1,100 providers ready to administer the shots. That includes pediatricians, pharmacies, community clinics, schools, and health agencies. Yesterday, a Food and Drug Administration advisory panel voted to back Pfizer's low-dose jab for children 5 to 11. Since July 1st, there have been more than 45,000 COVID cases in children in Minnesota and more than 300 pediatric hospitalizations related to the virus. Reporters are dialing in for the call and will likely have plenty of questions about the next phase of the vaccination effort and whatever else they wish to tell their readers, viewers, and listeners. As far as the latest trends are concerned, Commissioner Malcolm will probably have her regular situation update in just a moment. But in the meantime, I can tell you that according to NPR's crunching of the data, Minnesota's overall COVID numbers are still signaling the worst of the wave may be over. There's Jan Malcolm in the background. Let's join her now live on NPR News.
New laboratory confirmed cases and 31 additional deaths, unfortunately. We're now at a cumulative total of 781,548 cases and 8,612 lives lost among our fellow Minnesotans to COVID-19. We are still, for all of our counties except for Cook, listed by the CDC as having high rates of transmission. We have currently 911 COVID patients in the hospital, including 220 in ICU. Capacity remains tight. We're happy to see these improvements in these numbers in recent days, but watching very carefully to see if that trend holds. And it's still at a very, very high level. Capacity remains very tight, particularly for pediatric hospital beds. The latest data still show that there are 0 pediatric hospital beds available in some of our regions in the state. We do want to remind people, as Dr. Linfield has talked about in prior calls, that monoclonal antibody treatment can be really helpful in preventing hospitalization. So if you've been diagnosed or you're a high-risk person who's been exposed, we urge you to talk to your healthcare provider and to check the MDH website for more information on the availability of monoclonals. We're very thankful that today's figures show that another 2,442 people have received their first vaccine dose as of the data that are in the immunization system as of a couple days ago, and 2,182 more have completed their series. That brings us to 73.5% of Minnesotans age 12 and up, so all of those who are vaccine eligible and who have received at least one dose, and 70% of that currently eligible population has completed their series. As we've said many times, every single vaccination is good news on multiple levels for the person and for those immediately around them, as well as for the broader community, and to help reduce the pressure on our healthcare workers, both in acute care and long-term care. We're going to talk mostly today about in greater detail about the planning that we've been doing across the administration, specifically with MDE and the Children's Cabinet and MDH on being prepared to roll out the 5 to 11 vaccinations. But before we get to that topic, there are a couple of other things I'd like to update you on. As you know, this has been an excruciatingly long pandemic, and throughout it, we at MDH have been continually adapting our response and shifting our focus on areas that are the most urgent and the most relevant to where we are in the current stage of the response. And at this point, we're refocusing some of our work so that we can actually detect and intervene on outbreaks and clusters of cases faster, as well as digging deeper into cases involving special populations, variants, and vaccine breakthroughs. So what I mean by that is, first, we're making some adjustments to the case investigation and contact tracing process. We're going to be focusing on doing individual case investigation and contact tracing, calling cases for people under 18 years old, for vaccine breakthrough cases, all hospitalized and deceased cases, and those cases with emerging variants. As we've mentioned before, people are now significantly less likely to respond to contact tracing calls and have many more potential contacts than was true in previous stages of the pandemic. So the contact tracing is yielding less and less actionable information. So we want to focus our efforts on targeted situations where that in-depth case investigation and contact tracing process will have the most impact, and using some sophisticated analytic techniques to actually look at the data more real time as it comes in to try to spot patterns and clusters and outbreaks rather than waiting for the results of case investigation and contact tracing. We will still be sending an online survey to every positive case via text so that we can use that method to try to gather the key information from positive cases. More convenient for them and hopefully a higher response rate than calling by phone. Importantly, we're also going to send information to every positive case on what to do if you've tested positive, including how to reach out to people with whom you may have been in close contact. Just as a reminder, one way to help notify close contacts or to get notified yourself if you've been near someone who tests positive is to download the COVID Aware Minnesota app on your phone. The second thing I'd like to mention along with this evolution of our EPI strategy is that there will be some changes to some of the data that we report on a daily or weekly basis. Some of the changes are to further highlight where we are focusing our work, providing more in-depth relevant data for this stage of the pandemic, and some reflect the changes to the case investigation process that I mentioned. We're adding some new data to our website, including information on pediatric cases, vaccine breakthrough, and variants. Some data that are no longer relevant being updated. However, that archived data, which really isn't changing very much at this point in time, will remain available on our. So here's what's not changing about the data. We'll continue getting reports on every positive case through the laboratory reporting system. We'll continue collecting data that helps us inform public health recommendations and continue learning about COVID-19 so that we can more effectively prevent the spread. We'll continue to analyze and review targeted cases to identify trends and areas of concern. We will continue to work closely with settings that are particularly high risk for transmission and or severe illness, including nursing homes, assisted living, correctional settings, K-12 schools, and child care. The goal of infectious disease surveillance systems overall is to monitor diseases and have methods to detect signals where further investigation might be needed to prevent or slow outbreaks. And we'll be applying some of those same methods to this next phase of our COVID-19 epidemiological response. So I want to just quickly highlight a couple of the notable additions to the data that we have available online, or will soon have available online. The first edition involves new detail on school data. Effective tomorrow, we will be changing the list of cases in pre-K through grade 12 school buildings on the MDH website to include a range of COVID-19 cases for each school, rather than only displaying schools with 5 or more cases without differentiation. The minimum number of cases needed to be added to the list will remain as 5 or more in a 2-week period. And the school case data is going to move from the daily situation update page to the weekly report page. We're adding this detail to help give people a better understanding of what's happening in schools that have cases of COVID. The current list lumps together schools who have 5 with schools who have 30 or more without an ability to distinguish. So this more detailed breakdown, we hope, will give parents, students, and teachers more specific information about what's happening in their local school. Second, next week, we will be adding detail on reinfections. As the pandemic stretches past 20 months, it's possible, and we know it has happened, for one person to become infected with COVID-19 more than once, and in some cases, several times. This is called a reinfection. As reinfections have happened during the pandemic, we've been collecting that information, but we've not been including those reinfections in our overall case counts until now. We've just counted the person once without regard to the number of person they had been reinfected. Each of these reinfections was treated as a case, and the public health follow-up occurred. to provide them with information on what they should do. But again, we didn't count the subsequent cases as additional cases, just counted by the person. But CDC and the Council of State and Territorial Epidemiologists just recently provided for the nation an official case definition for what is a reinfection case, which they define a reinfection as when positive for COVID-19 more than 90 days after a previous positive test. This formal standardized definition is an important step for data consistency across the country and paves the way for us to now report reinfections in our Minnesota data. And I believe CDC is going to begin doing that soon as well. So we'll be making that addition of reinfection cases to the data next week. So shifting now to our main topic for today, you've heard us talk a lot about concerns over COVID-19 infections in school-age children, how much those case rates have grown and the proportion of cases that are now among our youngest kids. We described how this disease can and does impact young and healthy people, including children, and you've heard from physicians and health system leaders about that. So we know there are a lot of Minnesota parents today who are very relieved and grateful that the FDA Advisory Council last night recommended that FDA should move ahead with authorization of vaccines for 5 to 11-year-olds, Pfizer in particular. This is a really important step toward better protecting our children from COVID-19, especially with the Delta wave and the degree to which they are remain vulnerable in a situation still of very high viral activity around the state. As we wait for official guidance and the final green light to begin vaccinating, which comes from the CDC, MDH and vaccine providers around the state, which is hospitals, clinics, local public health, tribal health agencies, pharmacies, and state-run community and school-based clinics, are preparing to administer vaccines to our children as quickly. Our main goal with this 5 to 11 campaign is to ensure that the vaccine is widely, equitably, and efficiently available to all Minnesotans ages 5 to 11. And in order to meet families where they are, and we've done a lot of engagement with community groups to hear from them what their needs are and what they're looking for in this next wave of vaccination. So we've really built this plan significantly in response to that feedback that we've gotten. And in order to meet families where they really are, we have put together a statewide vaccination plan that offers quite a variety of locations and experiences for kids to get their shots. We have activated a network of 1,100 providers around Minnesota who have registered to do pediatric COVID vaccines specifically. This includes more than 530 healthcare providers, and this definition includes pediatric and family medicine clinics, primary care providers, federally qualified health centers, local public health agencies, tribal health agencies, and Indian Health Service locations. And more than 600 pharmacies will be participating in the 5 to 11 vaccination efforts. And as was true remains true with the adult vaccinations, a number of pharmacies and an increasing number of pharmacies are also participating in the federal retail pharmacy partnership program and getting a direct allocation from the federal government. To ensure equitable distribution of the vaccine and to expand access to more children and families, the administration is also partnering with school districts and charter schools to host vaccination clinics in or near school buildings for children and families. And we're delighted by the interest in the school community to participate. In a recent survey that the Department of Education did of Minnesota school districts and charter schools, 80% of those who responded to the survey indicated that they are interested in hosting vaccination clinics. And we are now across MDE, the Children's Cabinet, and MDH, partnering with districts and schools and already have at least 20 school-based vaccination clinics scheduled in high-need areas around Minnesota over the first couple of weeks. Our community vaccination program location at the Mall of America is going to triple capacity up to 1,500 shots per day to 5 to 11-year-olds. Now, Minnesota providers can't begin actually delivering pediatric vaccine until the CDC issues its final recommendations and until the vaccine arrives here in the state. We expect both of those things to happen next week. We hope that both happen next week, but that's our anticipation. Once the child is eligible, Minnesota families can contact their pediatrician, go to mn.gov/vaccine to find a vaccine opportunity near them, check the federal vaccine.gov website specifically to find pharmacy opportunities to get a shot for their child. This is a really exciting development, and it comes as a crucial moment as we are definitely still seeing a high level of case transmission in the state and very high levels of healthcare pressure as well, as we've talked about a lot. Since July 1st, there have been more than 45,200 pediatric cases of COVID-19 in Minnesota and more than 300 child hospitalizations for COVID-19 just in our state. As of yesterday, all but 17 pediatric ICU beds around the state were full, occupied by children sick not only with COVID-19, but other grave illnesses as well. COVID-19, we know, also can have long-term consequences, and frankly, we're still just beginning to understand that picture, especially in kids. We know the long COVID, we've heard estimates as high as 30% of all cases may have some long-term effects from COVID in the adult population. We don't know what that's going to look like in children yet. But we already have more than 100 Minnesota children who've been diagnosed with multisystem inflammatory syndrome, or MIS-C, which is a rare but very serious inflammatory condition associated with COVID-19. So today's news is truly good news for Minnesota families and children. Today, we're one step closer to having another layer of protection available to keep kids safe and protected against COVID-19. Yesterday's advisory committee recommendation affirms that that's the way to protect our children. In clinical trials, they were found to be highly safe and highly effective at preventing severe illness in children. Getting your child vaccinated gives you reassurance that your child is as well protected as possible from the worst impacts of COVID-19. Getting your child vaccinated helps them stay safe in school, sports, and other social activities. Getting your child vaccinated also protects other family members, friends, and neighbors. And getting Minnesota's kids vaccinated will let our kids get back to focusing on being kids again. As we enter this new phase of our COVID-19 response, our core goals are to keep our children healthy and safe, minimize the number of children who become ill with COVID-19, and slow the spread of COVID-19 in our schools and broader communities. And as we have throughout the vaccination campaign, we will continue to prioritize equitable access across race, income, and geography to ensure that all Minnesota children have an opportunity to get the COVID-19 vaccine. To the parents out there, we strongly encourage you to get your children vaccinated once they are eligible. Getting your children fully vaccinated before the holidays will help to keep everyone safe at the family gatherings I'm sure we're all looking forward to. And what's more, getting your kids vaccinated will help ensure that our schools are safe and able to continue to provide in-person learning. And we know the parents have a lot of questions. So please seek out trusted resources that can help you to understand the data on vaccinations, their benefits, and any risks. And with that, I'll turn it over to Commissioner Mueller for her thoughts.
Thank you, Commissioner Malcolm. I continue to be grateful for you and for all of our colleagues at the Minnesota Department of Health for your continued efforts to keep Minnesotans safe and healthy and our students in school. It is hard to believe that it's been just over 5 months since vaccines became available for Minnesotans age 12 and older, and we are once again at an exciting moment because we will soon be able to vaccinate even more Minnesota students. I remember exactly how I felt the day that the last spring when my daughter Kendra received her vaccine from All of America, knowing that both of my children could be protected from the potential severe impacts of COVID-19 was such a relief. And I'm so grateful that even more parents will soon be able to experience that relief. We know that with every dose given, our schools and our communities become safer. As Commissioner Malcolm mentioned, there are many ways that families will be able to get their young children vaccinated, and I'm grateful that Minnesotans have so many options. Schools have been an important part of our statewide vaccination strategy since January, when educators and school staff became eligible for the vaccine. This spring, when the vaccine became available to our older students, schools across the state hosted pop-up vaccine clinics to offer a convenient and familiar place for students and families to get vaccinated, especially in areas where it may be harder to access a healthcare clinic or a pharmacy. As we enter into this next phase, many of our schools will continue to offer these opportunities for their communities. In fact, I know that many districts are partnering with their local public health departments right now to get ready to vaccinate students ages 5 and older and their families. As Commissioner Malcolm pointed out, we recently surveyed our Minnesota school districts and charter schools, and 80% of the respondents indicated an interest in hosting vaccination clinics. The administration thus is partnering with districts and schools to host at least 20 school-based vaccination clinics in high-need areas around Minnesota over the next few weeks. I want to thank our school leaders and our school boards for this important work. I also want to acknowledge the incredible work of the scientists, health experts, and so many others who have made this vaccine possible. Before I wrap up, I want to take a moment to speak to parents. Please make a plan to get your kids vaccinated as soon as possible. I want to echo Commissioner Malcolm's words and remind parents getting your students vaccinated lets you know that your child is protected from severe cases of COVID-19. It also reduces the need for quarantining and allows them to stay safe and keep participating in school, sports, and other social activities. And vaccination helps protect other vulnerable family members, friends, and neighbors. Finally, these vaccines are safe and highly effective at preventing severe illness in children. In Minnesota, we have a plan to get our kids vaccinated. Our school and healthcare communities are ready to ensure that families have easy, barrier-free access to vaccines. And with that, I will pass it back to Mike.
Thank you, Commissioner Mueller. Operator, we're ready to take questions.
Thank you. And as a reminder, to ask a question, you will need to press star 1 on your telephone. Again, that's star 1 on your touch-tone telephone. Please stand by while we compile the Q&A roster. Your first question comes from the line of Kate Radatz from WCCO-TV. Your line is open.
Thanks for taking my question. I've heard from parents even who maybe even themselves they are vaccinated, but maybe are hesitant to vaccinate their children. How are you going to address those questions and concerns of parents who say, oh, I'm just nervous that maybe there's long-term side effects that we don't know about?
This is Commissioner Malcolm. I'll start and certainly welcome colleagues to chime in. First of all, we understand those questions. That's perfectly legitimate and reasonable to have questions about what we know about the vaccine in this age group. I think that the rigor of the review process has held up extremely well over the course of really only not even a year yet since we've been having vaccines available to first our vulnerable elders and then others in the community. But we've got now millions and millions and millions of real-world experiences, not only here in the U.S. but around the world. And I think the evidence on the safety and the effectiveness is just going to grow. But we do urge parents to talk to their pediatricians if they have one. We know not everybody does. We're going to be working with pediatricians as part of our outreach and education campaign because they certainly are a very trusted resource for parents. But Dr. Linfield, anything you'd care to add?
I agree with everything you've said, Commissioner Malcolm, and we certainly at the Health Department are available to talk to folks, and I know that primary care providers are getting ready to have the conversations with families. And so really, if you have questions, don't hesitate to ask them.
And I'll just add, pharmacists are also very good source of clinical information as well. And we know that they are working very hard to be resources to their communities when it comes to education as well as vaccine availability.
Thank you. And just a shorter question. Have you said, what are our population, how many kids this does affect for 5 to 11 here in Minnesota?
Yeah, I've seen two different figures, but the most recent one was just under 505,000 in this age group. Anybody free to correct me if you have anything more recent than that, but that's what we're looking at as the total population, and we are very much, have designed this plan anticipating that there's going to be a group of folks who are very eager to get this, and other folks who are going to be, as you said in your first question, waiting a bit and making sure that they get the information that they're looking for. So we're planning for a pretty busy first couple of weeks. We certainly hope that's what we see.
Great, thank you.
Your next question comes from the line of Theo Keat from Fox 9. Your line is open.
Hi, Commissioner Malcolm. First thing, did I hear you say at the Cub yesterday after your event with the governor that you expected somewhere between 30 and 40% of young children to actually get a shot?
That number came from a national survey that the Kaiser Family Foundation did, and I think it's been replicated by other data at the Federal Health and Human Services Department. And that figure was what percentage of parents say that they intend to get the vaccine right away, and then there's another group of folks who intend to get it but are not intending to necessarily do it right away, and a much smaller percentage of folks who at this point are not intending to get vaccinated for their kids. Okay.
So given that percentage of parents who say they want to get their kids vaccinated right away, and the 170,000 doses you're expecting to be in the state by late next week, do you think Minnesota will have enough doses right away to get everybody vaccinated who wants to be vaccinated within the first week or two?
Yes, we will, and we certainly designed the plan to make sure that we've got good diversification in sites where folks can get the vaccine and a range of choices for them. Bear in mind that in addition to the 170,000 coming to the state, there's also that federal retail program. That's, as far as we know, it's an additional nearly 85,000 doses that will come to Minnesota pharmacies. And then after this first bolus, as it's been referred to, we will be able to order additional vaccine every week, starting the week after the first rollout. So we're going to. It's a very different situation than it was in December and January, where there just was such a limited supply that the federal government feels that there's a very adequate supply of pediatric vaccine, and the planning and the logistics are about getting it where people want it as quickly as possible. Certainly not all in the first couple days, but as you say, and as we've done the planning, we've got events planned for, out for a longer period of time, and more events being planned every day. Commissioner Mueller or Aaron, anything that you want to add?
No, I believe that you covered that. Thank you, Commissioner Malcolm.
Okay, thank you.
Your next question comes from the line of Catherine Rickert from Minnesota Public Radio. Your line is open.
Hi. So we know that parents need to consent to getting their kids vaccinated, but will parents need to be present while their child is getting vaccinated?
I think I'll ask Commissioner Mueller to take that one. You're absolutely right. Parental consent is a part of the process, but I'll let her speak to the physical location.
Thank you, Commissioner Malcolm. I think there's a couple of pieces. We know that there are times when we really want to have families there as much as possible. And so whether that is done during the day, the clinic is being held during the day, or maybe before school or after school hours, nights and weekends, there are going to be diverse try to find as much opportunity.
One is the cat's balls.
I don't know whose child is talking, but I appreciate it.
I apologize. That was my 2-year-old, and after a year and a half, that is his first appearance on live radio. Please go ahead.
Well, we're happy to meet him.
We're glad you joined us. And so it's perfect timing as we're talking about schools and families, right? And so I think that we're looking at being as diverse as possible as the times to be able to allow for families to be with their students. We know that it's important, and we want to make sure that that is something that is available. We also know that for all families, it is not necessarily always possible, and so it's really going to depend on what that is looking like for them as their vaccine partner, as well as what that's looking like for them in their school.
Sure. So you kind of got at my second question, which is, I know two of my kids get their flu shots at school. I've never had to be there. I just had to sign something. So I guess, is this any different from that? And does it, describe in maybe a little more detail how this might complicate efforts to make this rollout equitable, parents who might not be able to get off work to join their kid, or how might you circumvent some of those challenges?
Right. And I think that is the point, is that we want to be as equitable as possible. And that's not always going to be possible for families.
I will just jump in here, too. This is Erin Bailey with the Governor's Children's Cabinet. Your question and point is right on. Vaccination partners have been doing vaccination in school sites and childcare settings for a long time, for many years prior to the COVID vaccination. That requirement around being on site really ultimately depends on who the provider is for the vaccine and what their specific policies are. But depending on that, as you're saying, and as your kids have experienced, and mine as well, that may not be required.
Okay, so just to be clear, it is not absolutely required that parents be there. It will depend on the setting in which the child is vaccinated, whether the parents have to be there or not.
And who the vaccination partner is and their policy.
Got it. Yeah. Thank you.
Thank you. And again, to ask a question, please press star 1 on your touchtone telephone. Your next question comes from the line of Tiffany Bowie from KMOJ. Your line is open.
Hi. Apologies if you've already answered this elsewhere, but I was wondering if you could explain the statistic that Native Hawaiian/other Pacific Islanders are testing positive for COVID-19 at twice the rate of white Minnesotans. Given how small this population is, I'm wondering if it's just a testing statistical anomaly or what it is.
Well, thanks for that question. And as we have talked about often, it is really important to look at these data, by population group, and we have seen those kinds of patterns, as you mentioned. Either Dr. Linfield or Kathy, would you chime in here?
I'm sorry, it was hard for me to hear. Which population do you want to hear the number for?
It was Asian Pacific Islanders and elevated rates, and just noting that for a small population, that's a lot of cases, and the reporter was wondering if we had any insights into that.
Yeah. I think you're right. It is a small population. We'll have to go back and look into it, and we will get back to you.
Kathy, anything that you would have to add?
I would say the same as Ruth, that we'd like to take a look at the data a little bit more and certainly return this question.
Thank you.
And there are no further questions at this time. Speakers, we have another question coming from the line of Jared Bean from KC News Now. Your line is open.
Yeah, hi. Thanks for taking my question. This is Jared from KUIC. I was wondering, what are the first initial steps to getting the younger population vaccinated that we'll be planning on rolling out here in the coming weeks?
Well, just kind of to recap the process. So there, last night, an advisory committee that reports into the Food and Drug Administration made their recommendation that the FDA should authorize the Pfizer vaccine for 5 to 11-year-olds, and that now goes to the Food and Drug Administration themselves. They typically respond with a finding pretty quickly, and then at that point it goes over to the Centers for Disease Control and Prevention. They also have an advisory group that is scheduled to meet on November 2nd and 3rd to review the data and make their what they typically do is make some additional clinical recommendations based on the data and any particular aspects of the clinical data that they want to call out. And then that committee's recommendation goes to Dr. Rochelle Walensky, the head of the CDC, and she is the one that kind of issues the final authorization. And when she does that, anticipating later next week, possibly early into the following, but we think this will be probably all happening during next week, the middle and later part of the week. What we've been working on and what the federal government's been working on is making sure that there is vaccine pre-positioned, if you will, around the country, and our providers have ordered vaccine so that it will be here and they'll be ready to start vaccinating really the next day, presumably after Dr. Walensky issues that final recommendation. So we're anticipating vaccinations could start, as early as late next week.
Great. And then what are some of the conversations that you have been having regarding the children's vaccine from maybe some of those who are more concerned about this younger age group?
Well, again, we certainly acknowledge the importance of parents being able to get their questions answered from trusted resources. So we've been talking a lot with the pediatricians and pediatric groups around the state to enlist their help in some of that education and outreach. And we just know that, trusted people are going to be important to answering those questions. We just all understand there are added questions about this. Erin Bailey has been doing a lot of the community engagement that I referenced, and we know there's a range of readiness out there, but I think we're hearing a lot of enthusiasm. Erin, would you care to comment further?
Yeah, I'll just add, we've leveraged the services and partnerships that we have through the state and through our advisory councils and through community partners to hear feedback from young people and from their families on what and how they're looking for in terms of vaccinating their children. And that is the information that we use to build this plan, and why you see a really robust plan that includes vaccination at a variety of places, working on creative partnerships with organizations in the community that can be fun locations for kids to get vaccination, thinking around incentives. And to the commissioner's point, the partnership with providers, we know that many families may ideally want to get their vaccination with a pediatrician, but that might not be possible due to a variety of barriers: transportation, work, capacity at the clinic. And so really leveraging and grateful for our pediatric community's willingness to be partnered in education and outreach and really validate the urgency around seeking vaccination, whatever the site and whatever makes the most sense for kids and families. And the commissioner also just spoke about education and outreach, which is really central to the governor's plan, in addition to just the vaccination, but making sure that kids and families have their questions answered in terms of the vaccine.
Thank you.
Operator, we have time for one more question.
Thank you. We have another question coming from the line of Catherine Rickert from Minnesota Public Radio. Your line is open.
Sure. Just a really quick clarifying question. Commissioner Malcolm, you said yesterday that the initial delivery of vaccines will be at about 170,000. Does that include the pharmacy distribution as well, or is that separate from that 170?
Yeah, right. The pharmacy allocation is in addition. So 170,000 that gets ordered by vaccine providers through us and kind of in accordance with the plan that we've been talking about here. And then we're estimating it's about a little under 85,000 that will come directly to pharmacies in addition.
Got it. Okay. Thank you.
All right, that is all the time we have for today's call.
And there we go. That's a wrap up for today here on NPR News. Catherine Richard, our reporter who's been following the COVID story for over a year and a half now, probably had the highlight of the conference call, providing one of the lighter moments since we've been airing these live briefings. When Catherine was asking a question earlier about whether parents need to be present when their kids get vaccinated, her 3-year-old made a cameo, and Catherine apologized, saying that's the first time that has happened during this strange pandemic time where people are multitasking in so many ways, including reporters in their home studios and offices. But as far as that question and its answer, Education Commissioner Heather Mueller said it was quite appropriate that Catherine's child made an appearance talking about kids and vaccinations. But no, parents' consent is required, but they will not have to be on site necessarily when shots are given out to the 5 to 11 cohort. They said it will depend on, she said it will depend on the provider of the vaccine who is administering the shots and the like. There will be enough doses available for all who want them. Commissioner Jan Malcolm said 170,000 doses of child-specific shots are available now. More are in the pipeline. She said it's good news for Minnesotans as we take another step to protect even more Minnesotans from COVID-19 with the pending approval of the Pfizer vax for that younger cohort probably by next week. She said she strongly encourages parents to get their kids vaccinated when they are eligible, and also learned that there'll be like 20 school-based vaccination clinics in the coming weeks from our Education Commissioner Heather Mueller. Much more on the story, of course, throughout the afternoon here on the air and on the line, online, that is, nprnews.org. So stay tuned to NPR. Right now, 2:42, and let's rejoin our regularly scheduled program in progress, the BBC NewsHour.
And activists who have their own agenda.